question is the accuracy of the monitoring. In other words, arterial lines which are invasive placed into an artery are the gold standard. The question is, are there continuous non-invasive alternatives of similar accuracy? The answer from the industry perspective is to get regulatory approval, you have to demonstrate equivalence to an arterial line. So it's approved to have the accuracy and precision equivalent to an arterial line without the risks of the invasion. You know, there is, although arterial lines are pretty safe, I've had many myself for experiments, they're not completely safe. And certainly the pain you're left with afterwards is not nice from that perspective.
I'll just chime in. Nobody wants, you know, who's going to deliver a baby wants an A-line. And
Yeah.
nobody wants to put an A-line in a pregnant patient. We've also used this in situations where I need better data. You know, I have a patient come into triage. Am I going to admit her or am I not going to admit her? Well, I don't want to put an A-line in just so I can get good blood pressure because her arm is not the right shape for an arm cuff. So I can use this and just get good data and make my clinical decisions versus admitting her for an A-line, which
Yeah.
would be absurd.
Megan, I think that's a really key point that you make, because a lot of clinical decision-making is affected by cognitive biases. And you're right, nobody wants to do those painful, invasive things in young, healthy moms, for example.
We, or me back in the hospital, used to think an A-line was virtually free because it's just a little plastic pipe we pop in. We forget all the other bits that go with it, which leaves a huge pile of plastic at the end of it. It's a massive pile of plastic that goes into landfill probably. The other thing is you have to have skilled nurses afterwards to look after the arterial line. So it's another nursing burden that's in place to make sure the A-line is safe, because if it comes detached, you can bleed out from it, literally bleed out from it. So